تستمر المعرفة عبر الكلمات. رسالة قصيرة تكمل رحلة التعلم في موقع آخر. تجسد الجبيل الصناعية رحلة التعلم مدى الحياة.
منصة المؤتمر. All speakers, please come to stage. أهلا بكم من جديد في المؤتمر الدولي السادس لمدن التعلم 2024 في الجبيل بالمملكة العربية السعودية إلى الجلسة العامة الثانية ومحورها حول التعلم مدى الحياة، تعزيز الصحة في المناطق الحضرية. نود الإشارة إلى أن السيد منصور عجلان البوعينين قد اعتذر عن المشاركة، كما اعتذر الأستاذ ناصر بن عبد الله العبد الكريم مدير عام التعليم في منطقة المدينة المنورة عن المشاركة في هذه الجلسة. ونيابة عنه يشارك معنا الأستاذة دانيا مرغلاني رئيس قسم التعليم المستمر في المدينة المنورة
lifelong education at Al-Madinah Munawwara, and Sultan al-Nuzha, head of health directorate in Al-Madinah Al-Munawwara. With them we have several experts.
Your Excellency, distinguished guests, welcome to plenary session 2. The topic of this session, everyone you can see, learning for life, promoting healthy in urban setting. Everyone know green and healthy might be most important concept from now and to the future. So these sessions will be focused on these two concepts, green and healthy. And as all of us knows, the city will be the most crowded place in our planet. How can we change our crowded city to be a green space to let our human have a healthy life? That's, I think, the question, the topic everyone cared about. Our session will have 5 speakers, and each of them will give us a very short presentation within 5 minutes. Then we have panel discussions within speakers. After that, the discussion will open to you. We will follow your questions and then develop a more deep discussion about the topic of this session. So please kindly prepare your questions when you are hearing about the speaker's presentation. And the time is limited in the following 1 hour and 15 minutes. I think you and I and all of us will spend a valuable time. First, let's invite our first speaker, Mr. Didier Jordan, who is the UNESCO Chair of Global Health and Education. He will give us a framework about how to conceive healthy in urban setting. Let's welcome.
Thank you very much, Professor Huang Wen. Yes, my role is just to set the scene and to share with you 3 simple ideas that will contribute, to build a kind of framework to listen to the great experts we have. As Professor Huang Wen just said, health and sustainable development, green cities, they are directly, closely linked. So the first idea is about thinking about what creates the health of people for real. The second will be the role, what the cities could do in terms of policies. And the last one is about the way in which we can move forward to concrete solutions. So first of all, you all know that when we speak about health, we are not talking about health care. Health care is only a very limited part of what creates health and what makes people healthy. It's between 10 and 20% of what makes you healthy. So it means that The environmental factors, the social factors, and education are at the very core of what builds and creates health. And clearly, yes, this is under the hands of the cities. But something changed. As you can see, this is the planet, the one in the past we thought we were living on. But no, this is not this planet now. We all know that the planet, in fact, is this one, a very small and frail one. And it has a fantastic impact on the health of the human beings and, of course, the animals and the plants. And then when we think of what creates the health of the people for real, we also have to realize that the impact of climate change is going to influence the inequalities and also communicable disease, non-communicable disease, mental health issues. So talking about health, it's talking about municipal policies because they are contributing to improve the health of the population. The second idea is extremely simple. Just remember what all the great speakers we had this morning said. It's about creating environments that are healthy, greening the environment, but it's also building the capacities of the population. And this is what people very often miss. You cannot have a healthy city if you don't have healthy people having the knowledge and needed knowledge and skills. So the third very simple idea is about leadership. How could we move forward? We need leaders, and we have here 4 great leaders. We need a vision, we need a strategy, and we need managerial competencies. The vision is this one. The idea is that you cannot create health without the population. You need to have the population with you, and this is critical because people very often see the population as the problem. In fact, this is part of the solution. And when we are talking about climate action is something that seems a bit vague. How could we make climate action concrete for the population? Just talk about health and the impacts of climate change on health in order to be able to get people on board. And then what we're going to learn now is the way in which these leaders made these changes possible. And research shows that you need always 3 things to change something at the level of a city or a country that's the same. You need to be aware of the problems, the policymakers and the population. You need to have solutions. It means expertise for that. And you need to have a good political context. And this is what opens windows of opportunities. And yes, what is typical to all the leaders, mayors and their teams, is that they are able to open windows of opportunities to develop policies that led to develop the capacities of the population. Over to you, Madam President.
Thank you very much, Mr. Dido Jordan. He gave us a very short but very clearly description about a framework. How can we think about healthy and climate change? What we have noticed and what we have not noticed. And those missing might be more important for us to think further, to make further actions. So let's move to the second speaker, Mr. Oquado Abider. I'm sorry. Could you please introduce yourself? And please use your 5 minutes. Thank you.
Thank you. أتحدث عن مدينة ابن جرير بالمملكة المغربية. مدينتنا
Our city
تتميز
is
بالخصوصيات الكثيرة
characterized
حيث نسميها مدينة الخصوصيات.
by
أول
many specific characteristics. We call it the city of specificities. The first one is that it's a modern, small, upcoming city in the middle of an agricultural region, a rural area. And this rural area
أقول 4 عقود
has witnessed over 4 decades
حادا ومزمنا، وبالتالي عرفت المنطقة هجرة قروية مكثفة
a lot of migration
الذي نسميه
to the city center because of the drought, because our town witnessed, and our area witnessed a heavy drought over the past 10 years. The population are mostly from neighboring villages, and they had to migrate, they had to leave their villages because of the drought. This is a very important introduction to our town because it gives you an idea about the demographics of our city. So the majority of the population are illiterate, especially women, and poverty. We suffer from a lot of poverty.
إلى الصحة يكون
So access to health
وصعب.
is difficult and costly at the same time.
التغطية
Even the infrastructure
وجدناها في وضع هش
is very fragile,
ومن
very weak. And this was our starting point.
وركزنا على
We
الجانب
first
الصحي.
tried to begin with
كما نقول في المغرب
health, because as we say in Morocco,
كل شيء.
health is everything.
استراتيجيتنا
Our
من
strategy
التشخيص. والتشخيص
starts from diagnosis. This was our diagnosis. This is the diagnosis that we started with. We have a fragile infrastructure, a weak infrastructure. We have a lot of illiteracy, especially amongst women, and poverty is prevalent. Even
غير مؤمن.
lighting and
الانطلاقة كانت نحتاج في استراتيجية نحتاج إلى المال
and sanitation does not cover the whole city. So we needed a plan and we needed financing to upgrade the situation. We also need to raise awareness in order to find solutions as quick as possible. So
نسبة 80%
our municipality allocated 80% of its actions to the sanitation network and lighting and to fix the roads. This is what we worked on during the past 2 years.
أخذنا على عاتقنا
Second,
تدعيم
the municipal council
بالجماعة
took upon itself
يسمى
to establish an office that we called the Office for Health.
من الموظفين أكثر
We appointed staff, sufficient staff. We also allocated funds to this office that started to provide health services, including provision of medication for free, especially for chronic patients, and to provide
يوفر رقم أخضر
vaccination
لكل
for children
سيارة إسعاف
and
مجان 24
to provide ambulances
أيضا
for all requests. Everybody who requests an ambulance will get an ambulance for free 24/7. We also organized campaigns with the professionals and especially, for example, if we're talking about cafes or different merchants that needed the health certification in order to provide their services. So we worked with them. Then we developed a partnership with the Muhammad VI University that provides education in different fields and is also pioneering in its research work. This university came up with electric bicycles. They developed and built electric bicycles to assist in our work towards zero emissions. They also conducted research in green energy, and we have a green energy park which is under construction and will provide solar panels. They will be providing solar panels at reasonable prices to the population of the city. The university also conducts awareness-raising campaigns. For example, they organize an annual festival, cinema festival, and we know that cinema also plays a role in raising awareness in cultural activism in general. They also organize seminars and conferences and meetings for women's cooperatives to support them, to encourage them. This is the work that this university does to support women in developing their cooperatives, small projects to create an income for these women to enable them to access health services. We also worked with the Al-Sharif complex for the production of phosphates. It's a company that produces phosphates. This company established a green city, what they call a green city. And this green city has multiple tasks, all of them focusing on health. First, it's a green city. So all electricity is generated through solar panels. It's all green energy. Transportation within that city is also based on electric vehicles. They also coordinated with the municipality to plant trees and parks, trying to go beyond the global average of square meter of green area per individual. It was 1 square meter, now it's over 16 square meters per individual of green areas. Currently, we are building a regional hospital that is also a university hospital at the same time. That's in Abrujari city. A regional hospital, a university hospital to benefit the residents, all through the partnership with this company, this phosphate company. The company has the money that the municipality does not have and that the people don't have. So we're combining what we have and what that company can provide. We also focus on conduct several activities in collaboration with civil society. For example, on an annual basis, every season, we organize medical campaigns, specialized medical campaigns in every neighborhood. For example, if there are there's a need for pediatricians in a certain neighborhood, we do a campaign with pediatricians, with ophthalmologists in another, etc. And now we have a center, we have health centers in popular neighborhoods in collaboration with the Ministry of Health that we called the Center for for Mother and Child Health. And it provides health services for mothers and children for free. Thank you very much.
Thank you so much. Our Mayor Awadi Abdelatif gave us a very clear roadmap to help to improve the citizens' healthy situation in their city. First, he explained what's the problems they met: poverty, immigration, women, children. And it's really difficult to let these citizens access to health because it's costly. So they set up an office for healthy. And they make policy and plans to improve the whole city's situation on healthy. And also the most important, they set up a close partnership with university and companies. Company can help to provide money. University can research, can make more research based on the local situation. So I think your example is very helpful for the other city to access to more healthy. Thank you again. Thank you so much. And let's invite our third speaker. Thank you. Our third speaker, Mr. Mario Alberto Ishi, come from the Jewish Party, Argentina. Oh, okay, thank you, thank you.
Excelentísimos representantes, distinguidos delegados, señoras, señores, es un gusto estar hoy acá. Buenas tardes a todos. Es un honor dirigirme a este recinto que simboliza la paz, la prosperidad
this august
y el
assembly
bienestar
symbolizes
de
peace.
todos. En esta oportunidad me toca hablar de educación.
I am lucky enough to be able to speak about education today.
En la educación tenemos
When it comes to education,
nuestros queridos hermanos del mundo
we have all of our dear brothers all around
en crisis.
the world. They have many crises, and we know that there are political issues, different political ideologies. However, education is cross-cutting.
Todas las ciudades.
It goes beyond borders, beyond cities.
Y trabajar fuertemente sobre la educación.
And that is why we are focusing so much on education.
Por un lado,
On one side,
encontramos países
we have
que están
countries
trabajando ya con
who are
Industria 4.0,
working
están trabajando
with the
con
Industry 4.0, they're working with artificial intelligence, and on the other side, we have countries that have no food, no water, and children who can't even go to school.
que ver cómo solucionamos este
So,
problema
how can we overcome these issues
en el mundo.
in our world?
Hay millones de niños rurales.
There are children in rural areas, children who are marginalized, they can't study,
Todos contribuyen a la falta económica.
and we all know about the lack of economic resources they have.
A ver, yo en mi distrito tengo un video
I have a
de uno de los distritos más
video
pobres de la provincia de
where
Buenos
we
Aires.
can see some of the poorest areas of Buenos Aires in Argentina.
Hace 25 años que soy
And around
intendente
25 years ago,
y he tratado de sacar
we
la pobreza
thought about how we could pull this city out of poverty. This city where 450,000, or this neighborhood where 450,000 people live.
en este caso
I believe
muy
that
profunda y es una crisis que hay que
inequality runs very deep, and this is something that needs to be taken into
Nosotros
account.
tenemos, por ejemplo,
We have, for
hoy
example,
se celebra
today,
el Día Internacional del Discapacitado,
an
lo
International Day.
diciembre,
In fact,
Día Internacional
this is the
del Discapacitado.
International Day for persons with disabilities.
De ciegos
We have set up a
visuales,
sign language school,
acúsicos y mentales.
and we have also set up learning installations for people with mental disabilities.
Por eso hoy
That is why I'd like to salute the work that all of those working in these sectors are doing. And so I'm very happy to be here today and say to you that when it comes to education, we have to ask ourselves a question: how can there be so much difference in the world? Latin America is 20 years behind what we might call the first world. For example, United States. I was in China not too long ago, and I was able to ask or think about how in China, for example, you can do any kind of studies that you want, whereas in Latin America you're even asking yourself whether you'll be able to study or not. For example, in Latin America, if we want 1% economic growth, in other countries it's not exactly the same situation. If we look at the situation in Africa, for example, Africa is going to have 4% growth, thanks largely to the aid that is coming from China to Africa. 50 countries in Africa, and these are countries that are going to move forward out of the situation of marginalisation and move forward into digital age. So, there's also another document of UNESCO that all governments, all countries of the world can refer to. There's often this idea that we're not going to be able to reach our goals because of our economic differences. But it's central governments that need to dedicate a part of their national budget, 3 or 4 or 5% more than they currently do, for education. If not, then there will be no escape from our situation of poverty, and the gap will only get bigger and bigger over time. Because we are seeing that in some countries they're able to reach the moon, to put satellites into the sky. In other countries, people are still travelling around in a horse and cart. So it's really about the political will of central governments to focus on education. And if we can solve the issue of education, we'll be able to solve the issues of insecurity and health and the environmental issues we face. We will become first world countries, developed countries. There are people who can't gain access to basic health services, to basic medicine. It's one of the fundamental human rights. We need to be able to give people education and health. And if we can deal with the health issue, then we can also overcome the education issue. And we often speak about the economic issues of countries. In different countries, we also speak here about water issues. I've heard different speakers from different countries are investing money just in being able to have
que va a sacar mano de obra de trabajadores, va a traer beneficios importantes, sí, en salud lo va a traer, en distintos lugares lo va a traer. La inteligencia artificial es lo que viene y hay que ir hacia ahí. Nosotros, gracias a Dios, en José Cepaz tengo chicos de 45 días hasta la universidad que le puedo dar gratis. He hecho Quien le habla hizo 115 escuelas, 5 facultades y una universidad, en el cual tengo 52.000 alumnos estudiando. Nuestro distrito está saliendo, pero sale a través de la educación. Yo pienso que todos los que somos alcaldes hoy tenemos que apostar fuertemente a la educación. Es lo principal para poder salir un distrito, un pueblo hacia adelante. Sin educación no hay futuro. Trabajemos sobre la educación, solucionemos los problemas educativos, ahí vamos a solucionar problemas también, los problemas de salud, los problemas de infraestructura y otras cosas, pero primero es la educación para salir hacia adelante. Gracias por todo, le agradezco mucho el momento de haber estado acá y decirles a todos que buena vida.
Thank you again, Mayo, Maleo, Alberto Ishi.
La ciudad de José C. Paz, ubicada al noroeste del conurbano bonaerense de la República Argentina, era hasta hace unos años uno de los distritos más vulnerables debido a múltiples factores entre los que podemos contemplar la falta de estructura, la escasez de fuentes de trabajo, el crecimiento demográfico sostenido y todo tipo de dificultades sociales. El alcalde Mario Ishi logró revertir ese escenario por completo a partir de su trayectoria ejecutiva y gubernamental. En principio fue vital establecer un contexto propicio para el desarrollo con políticas públicas que respondieran a las necesidades básicas de la comunidad para brindar la predisposición al aprendizaje, ya que estadísticamente el mayor porcentaje de abandonos y ausencia en las escuelas se da por la realidad socioeconómica. Así, se crearon en los últimos años 10 hospitales municipales de atención gratuita con alta complejidad para el diagnóstico y tratamiento, 118 escuelas de nivel inicial, primario, secundario y técnico con perfil industrial. El abordaje de la educación especial, con 3 escuelas adaptadas a distintas necesidades, con un sistema de traslado personalizado y gratuito que facilita la presencialidad de los alumnos. 5 centros de primera infancia. Una universidad nacional con distintas facultades. Y la educación para adultos. La visión del alcalde Ishi se centralizó desde sus inicios en la educación como pilar fundamental, convencido de que un individuo en proceso de aprendizaje tiene libertad y herramientas para poder revertir la desigualdad en la que nace. Y con más educación, se logran mejores resultados en materias de salud, seguridad y sostenibilidad. Por ello, centralizó la mayor parte del capital en este aspecto, que convierte a José C. Paz en el distrito argentino que más invirtió en el área. En este punto, la regionalización de la educación, que ofrece cercanía al potencial aprendiz, desempeña un rol clave, ya sea en el campo formal o no formal, derribando los obstáculos que pueden complicar el acceso comunitario a la enseñanza. Así es que contamos con una amplia oferta en capacitación de oficios para la inserción laboral a través de los centros de formación profesional y talleres de informática e idioma gratuitos hace más de 20 años que han sentado las bases para seguir construyendo. Los centros de primera infancia proponen formar y contener de manera integral a bebés y niños de entre 45 días y 4 años, en la etapa previa a la escolarización obligatoria, con un seguimiento médico y nutricional al tiempo en que se estimulan las habilidades cognitivas e intelectuales a muy temprana edad, con impacto directo a futuro en la formación de adultos mejor capacitados. Como contrapropuesta de educación continua, brinda a los cuidadores de estos niños la posibilidad de ocupar esas horas terminando sus estudios o trabajando. Desde muy pequeños, los niños experimentan su primer acercamiento al mundo digital con el uso de la computadora y adquieren conocimientos de acuerdo a sus preferencias individuales. Y esto hace que tengamos que replantearnos la estructura actual de la educación obligatoria. Según ha expresado nuestro alcalde y secretario ejecutivo de Argentina de la red, es imprescindible abrir un debate sobre la modificación de los métodos y programas de estudio en América Latina. Es necesario cambiar la matriz para seguir avanzando, despertar la inquietud de aprender. Los individuos y sus intereses se han transformado y diversificado, y el avance imparable de la innovación tecnológica nos interpela permanentemente sobre cuál será nuestro futuro. Sin duda, ese futuro está en el conocimiento. Y aquí debe plantearse la generación de acciones que promuevan la alfabetización digital en todos los sectores, como parte de la estrategia de inclusión y adaptabilidad. El gran desafío de ciudades como la nuestra, aún en vías de desarrollo y con condiciones muchas veces adversas, es la reducción de la brecha entre quienes acceden o no a la tecnología. Una porción importante de los excluidos en la digitalización corresponde a los adultos mayores, que muchas veces se resisten a explorar este universo desconocido para ellos por una cuestión generacional, hasta que comienzan a sentir las limitaciones que se les presentan. El Centro Municipal La Bella Estación es un espacio para adultos mayores en situación de calle donde se ofrece una capacitación intensiva sobre el uso de Internet, sus beneficios, el correcto uso de los dispositivos, y hemos comprobado en poco tiempo los efectos positivos que ha provocado en el desempeño individual. La enseñanza adaptada a otras necesidades específicas por discapacidades es también tenida en cuenta en nuestro plan de alfabetización digital, como así también el acercamiento del material de estudio como herramienta a alumnos secundarios de escuelas públicas, con entrega de tablets o notebooks, por ejemplo, para seguir acortando esa brecha. La formación superior o universitaria también están presentes. En José C. Paz contamos con una universidad nacional con gran oferta académica que se extiende en varias facultades como la de Ciencias Médicas, que han sido construidas con recursos económicos y mano de obra local y que es parte de la transformación total que transitamos. Con más de 53.000 estudiantes formándose, un 80% de primeros profesionales de sus familias y su participación activa en el crecimiento comunitario frente a la vulnerabilidad contribuyen al desarrollo y a la prosperidad. Hoy, estamos construyendo la facultad del futuro. La Facultad de Ciencias, Tecnología, Innovación, Robótica, Ingeniería e Inteligencia Artificial fue pensada para dar respuesta a la incertidumbre que pueda generar la aplicación en el campo laboral en algún tiempo. Ofrecerá carreras donde la innovación y el conocimiento estarán fusionados y simultáneamente inmersos en la industria 4.0, ya que estamos a las puertas de la cuarta revolución industrial a nivel global, donde la automatización, la Internet de las cosas, el modo de almacenamiento de datos, la transformación de la producción, la inteligencia artificial y la realidad aumentada redefinen nuestro modo de vida personal y nuestro trabajo. La tarea es ardua y constante, con la aplicación de recursos que resulten en el cumplimiento de la premisa de alcanzar el bienestar general, profundizando la transformación en cuestiones científicas, gubernamentales, sociales y de aprendizaje continuo que fomenta la evolución de los pueblos, la paridad de oportunidades, la paz y la justicia social y el crecimiento económico, consecuentes con la urgencia mundial a resolver según la Agenda 2030 con la que estamos comprometidos.
Thank you, Mayor Maleo, Alberto, Ishi. And we have a clear vision about your beautiful city. The deep impressions I've got from your presentation is that we might facing the different questions, problems in different country, different city. But we might find the different way towards different modernization. But education will definitely provide the solution for us to create a more beautiful future. So I think all of us can do more to improve our education system now. And in the next time, we will have two representatives from Armadina Awala. Both of them will give us a brief introduction about how their city improves the health of citizens. Let's welcome.
بسم الله الرحمن الرحيم. السادة الحضور، أصحاب
Ladies and
المعالي،
gentlemen,
أصحاب السعادة،
Excellencies,
أسعد الله
dear
مساءكم
guests,
جميعا.
good afternoon. On behalf of His Excellency Director General of Education for the Medina Al Munawwara, Nasser bin Abdullah Abdul Karim, we would like to give a presentation today about the complementarity between health and education, entitled Taiba Educational City for Special Education Towards Sustainable and Healthy Education. The Taiba Educational City for Special Education is an institute that we take pride in Al-Madina Al-Munawwara city. We will tell you about it through the following presentation. The strategy of Taiba Educational City for Special Education is based on several bylaws and guidelines about special education, as well as the strategy for education in Al-Madina Al-Munawwara area, as well as the strategy of the Ministry of Education. It is also based on specific indicators and standards for special education, and as well as those set by the Committee for the Evaluation of Education and the General Strategy of Education in the KSA. It is also based on a system of taking care of the handicapped and people with special needs in the KSA, and the National Program for Transformation, as well as initiatives from the Ministry of Education, as well as, of course, the vision of KSA 2030. The directives of international organizations that cater for people with special needs. What is the importance of Taiba Educational City for Special Education? Its importance hinges on several aspects. It is based on equitable and good education for all. It is premised on equity, justice, inclusiveness, and sustainable communities. It also caters for building a healthy environment for its students. It also fosters culture and pioneering activities. There are several measures that Taiba Educational City has taken to establish a healthy environment. There is a program, a fitness program, as well as the diagnostic tests. In addition, Taiba Educational City has a vision and an aim. It aims to provide quality services to people in need and handicapped. It provides educational and rehabilitation services, as well as treatment, guidance, and entertainment for its beneficiaries to meet their needs and develop their skills and knowledge in collaboration with other stakeholders to make sure that they are active participants within their communities on the local, regional, and international level. It is based on several values: complementarity, responsibility, creativity, and transparency. The Taiba City for Special Education in Al-Madina Al-Munawwara is an educational establishment following the design of international standards. It was built over the area of 50,000 square kilometers at a cost of 57 million Saudi riyals. It includes 6 school buildings and 2 administrative buildings, in addition to 3 closed sports facilities. In the first phase, it includes 8 educational programs for different disabilities, different types of disabilities, even learning disabilities for boys and girls. It applies standards of comprehensive education, and it can reach 5,500 beneficiaries. And it is built along the highest standards to meet the needs of people with disabilities, people with special needs. The services provided by the Office of Diagnosis and Development at Taiba City. It provides several services, diagnosis and measurements for boys and girls, appointments, setting appointments, sessions for rehabilitation, as well as family counseling and behavioral counseling and early intervention for hearing disabilities and mental disabilities. The services that are provided by the ministry in Taiba Educational City. There are several services that are provided by the Ministry of Human Resources, such as reducing cost of travel and providing support for medical appliances and giving support for fees for visas and other services that are provided by the Ministry of Human Resources for Taiba Educational City. Taiba Educational City for Special Education has taken several measures pertaining to climate change through participation in the Environment Award under the slogan, "The environment is for us and for future generations." They worked at raising awareness on the environment, the green environment programs, the blue environment programs, and educational centers without plastic bags, as well as an initiative to plant trees and using electric vehicles to reduce pollution. They also established several parks and planted trees around the building to improve air quality, as well as several public parks and areas for sport and recreation within the city. Taiba City used modern technology to expand the scope of education and learning. One of those tools was using the platform Madrasati and the cultural library for the blind, talents for people with special needs, a center for learning aids, a digital center, as well as a project for rehabilitation of people with special needs pertaining to speech therapy, as well as several participating in several international competitions. And now my colleague, Mr. Sultan Al-Nuzha, will continue this presentation. Good afternoon, everyone. Health is not about not being sick. It's about general health. We're talking about social and economic and other types of health. So this city is built over 50,000 square kilometers. Taiba Center is a special educational institute for people with special needs. Taiba city provides work opportunities for people with special needs and the handicapped through the initiative for continuing education and the initiative of Riyali and several other initiatives. The project of Jusur or bridges, as well as providing training within Taiba city for the staff, and as well as an initiative for a glossary, a dictionary for Braille language. And His Highness Prince Salman, the Prince of that region, also sponsored the program within the vision of learning cities. His deputy also took part in several activities within classes in this school. The center provided 1,975 centers for speech therapy, and it improved the life of 80 people with hearing handicaps, and they contributed to the support of these people with hearing handicapped, as well as other types of handicap. They have provided several environment-friendly buses. We have 212 women and 247 men working at this city. There's a continuing lifelong learning center in the city. We also have a lot of classes for literacy and other continuing education classes. The Shura Council gave special mention to this educational city. It also received several prizes, the prize of Mohammed bin Saleh bin Sultan, and it also participated in the Dubai Expo, and it also won the competition for Arab safety. The Taiba city has several partnerships. We have 20 community partnerships to a total of 2 million and 30,500. There are also 35 million was allocated for housing for students, providing 200 rooms for students in collaboration with the Council for Community Organizations. So the civil society community organizations as well as businesses contributed to funding this city. There are 9 clinics with various specializations. They provided 4,650 types of social services. So it is a comprehensive city where the student can benefit as well as their parents and their families. So they acquire services, not only educational, but also community services, social services, as well as behavioral support. 4 clinics for hearing aids were established in Taiba city, and 80 people benefited from that. Digital reality is also an option, and there are mobile clinics. There are also virtual clinics within Taiba. There's also screening for breast cancer for mothers and women. There's also vaccination and screening. And now we will show you a video about Taiba Educational City.
فرد في هذا الوطن منذ تأسيسها، والمملكة تقدم بلا حدود لدعم التعليم، واضعة ذوي الإعاقة في مقدمة اهتماماتها ليكون لهم حق التعليم المتكامل والاندماج الفعال في المجتمع. ومن هنا بادرت وزارة التعليم بإنشاء مدينة طيبة التعليمية للتربية الخاصة، وأطلقت خدماتها عام 2019 على مساحة امتدت إلى 50,000 متر مربع، لتكون أحد أكبر الصروح التعليمية التي تعمل في خدمة الأشخاص ذوي الإعاقة نموذجاً تشغيلياً مبتكرا يجمع كافة الجهات الحكومية والأهلية والخاصة لتحسين جودة حياة الأشخاص ذوي الإعاقة. 11 مبناً تعليمياً يضم أحدث ما توصلت له التجهيزات الحديثة، حيث تتكون مدينة طيبة من مبنيين للتشخيص والنمو تقدم فيهما خدمات متكاملة تشمل خدمات التدخل المبكر والخدمات التشخيصية والتدريبات السلوكية والنطق والتخاطب وغيرها من الخدمات المساندة، إضافة إلى تقديم الدعم الطبي والاجتماعي الذي يصل إلى الأسر. أما الجانب الأكاديمي فهناك 6 مبان تعليمية للتربية الفكرية والتوحد والإعاقات السمعية والبصرية، مجهزة بكل ما يحتاجه طلابنا ويتناسب معهم بكافة المراحل الدراسية، بطاقة استيعابية تصل إلى 1000 طالب وطالبة. ولإثراء تجربتهم تضم المدينة 3 صالات رياضية مجهزة لمختلف أنواع الإعاقات وشدتها، وميدان للفروسية يجمع بين الترفيه والعلاج، ومساحات ترفيهية تعزز من ثقتهم بأنفسهم. أكثر من 5,000 مستفيد من المدينة المنورة خاصة ومن مناطق المملكة عامة وجدوا في مدينة طيبة نافذة نحو خدمات متكاملة رائدة لأكثر من 40 خدمة نوعية، حيث التعليم والعلاج والدعم والوصول الشامل، كل ذلك ليكونوا جزءاً فاعلاً من مجتمعنا اليوم وغدا. ومع رؤية مستقبلية تستشرف الأفضل، تعمل المدينة على افتتاح سكن داخلي يمتد على مساحة 9,200 متر مربع بطاقة استيعابية ل200 نزيل، بإشراف مباشر من إمارة المنطقة وبمشاركة فاعلة من القطاع الخاص، مجهز لرعاية طلاب التوحد وذوي الإعاقات المتعددة بهدف تخفيف الأعباء على أسرهم وتوفير بيئة متكاملة في موطنهم. مدينة طيبة ليست مجرد منشأة تعليمية، بل نافذة شاملة جمعت التعليم والعلاج والرعاية لتكون أحد ثمار رؤية 2030 في تمكين الأشخاص ذوي الإعاقة وضمان مستقبل مليء بالفرص. كل ذلك لتحقيق رؤية مدينة طيبة التعليمية للتربية الخاصة بأن تكون معياراً عالمياً للتميز في تقديم الخدمات للأشخاص ذوي الإعاقة.
الله يعطيكم العافية. هذا بالإضافة إلى أن المدينة المنورة حاصلة على
المدينة المنورة
من منظمة الصحة العالمية
is also accredited by the World Health Organization as a healthy city. Thank you very much.
Thank you so much. Thank you for all the excellent presentation and excellent videos. Now let's welcome Mr. Didio Jordan come back. Give us a very brief conclusion about our speaker's presentation. Let's welcome.
Thank you very much. It's just an amazing session with such a great presentation. And I don't know what you think, but what is interesting is that the starting point is very different. In one case, it's special needs. In one case, this is, I would say, the living environment. In one case, this is education. But at the end, it's always the mobilization of different actors at a local level in order to create a comprehensive policy that influences education, health, and environment. So it's not a kind of a conclusion, it's just important things. What is common to what has been said is the fact that, you know, the solution does not come from outside. And this is the first idea here. The solutions also come from inside. All the people, the different institutions, formal, non-formal, informal education institutions, and what makes all these different projects and policies relevant is the capacity of mobilization, not only of the school systems, but also the healthcare system, the association, faith community, sports club, the municipality, of course, and all the different services, and the families. And probably what makes a successful policy in the field, this is the capacity of the municipality to federate the energies around education and around lifelong learning for health and sustainability. Idea number one, and this is clearly common to all that has been said. The second thing, it's more a suggestion. This is the health learning pathway. This is a concept that has been developed for the previous ICLC meeting in Yeonsu 3 years ago, together with the UNESCO Institute for Lifelong Learning and the UNESCO Chair in Global Health and Education. It's trying to offer a framework that is based on research and experiences. A lot of experiences are also linked to research. The idea is that all these different initiatives have in common to try to influence the environment, the access to quality healthcare service, and the lifelong learning and the education in general. Knowing that every city on this planet has fantastic resources in the field, the first step is clearly to try to value what is already existing. Making an inventory is always at the very beginning of every capacity to build a comprehensive policy, but also to share, to align, and to improve, especially by training, by new expertise. So this way of thinking and building municipal policy through valuing, sharing, aligning, improving, that could lead us to build lifelong learning for health policies, and especially the health learning pathway. And these health learning pathways are existing in practices. This example is the one from the city of Clermont-Ferrand in France. What they have in common is to have, first of all, a lifelong learning perspective from the beginning of the life to the end, and to mobilize all the different actors, formal, non-formal settings, families, associations, and communities. This is probably an interesting way forward. And final idea is how to move forward. There's probably something that we are sharing in this room, is that the question for the future is not only what kind of planet are we leaving to our children. This is an important question, of course. It's about pollution, it's about regulation, it's about economic orientation and strategies, this is about renewable energy. But in this room, we know that it's only half of what is needed. The other question is, what kind of future adults are we leaving to our planet? It's not only the planet, it's also the people. And that's why lifelong learning is absolutely critical for that. And probably this balance between what planet are we leaving to our children and what future adults are we leaving to our planet, this is probably what's behind. And then, of course, to move forward, we are lucky. We have fantastic experts, amazing experience through the global network of learning cities. As I already said, there's resources, training resources, the implementation guide of the Yeonsu Declaration, documents produced by the UNESCO Institute for Lifelong Learning, and our UNESCO chairs, but also many UNESCO chairs. I don't know if you know the UNESCO chairs. This is, of course, academic institutions that are made for two things: producing and sharing knowledge. Producing knowledge, this is research, and sharing knowledge, this is consultancy to support member states and cities. And you have UNESCO chairs in your countries. And of course, all you know about partnership and the way in which we could work together. So yes, we have a lot of local assets, and what is at stake is to mobilize them. Coherence within what is offered to the population is the key to build health learning pathway. And yes, we can move together by partnership at a local level, but also by the fantastic support of this amazing global network. Over to you.
Thank you again, Mr. Didier Jordan. In the next stage, I would like to invite you, give our audience a very brief and clear answer, focus on the following 3 questions because of limited time. I know you have a lot to say. And this 3 question is, what are the most important assets you have in your city for lifelong learning, for healthy and sustainability? And what assets still need to be developed? The second question is, which stakeholders would be the first to engage in your city to begin building a healthy learning pathway for all? And the third question is, what is the one action you can take today for healthy and climate action to benefit future communities in your city? Who would like to be the first one? Mr. Cott.
بالنسبة للسؤال الأول والثاني
The first and second
نجيب
questions,
عليهم مرة واحدة.
I will answer
السؤال
them
الأول
both at
والثاني
once.
نقول أنه
And I'd like to say that in Bengrir city,
المخاطب
the
المستمر
main partner, the constant partner
يوميا
with whom we work on a daily basis
البنيات الصحية
to provide health infrastructure and to offer health services to
ومؤهل
the whole society.
كما قلت هو أن النتيجة اللي وصلنا لها
The conclusion that we came up with is that a Sharif Phosphate company,
مواطنة
which is a local company that is providing all the necessary financial resources for these services. And as I said, now we are currently preparing to open in this small city of 100,000 citizens, we are going to open a university hospital.
وأيضا بصدد
And
نهاية الأشغال
we are establishing a regional hospital as well.
للقدرات ديالهم الاستيعابية
Both hospitals
الآن الساكنة ديال
have a capacity that extends beyond the city. As
بالفعل الإجراءات
I said, we had difficulties in the past decade because of migration, because of we did not have clear objectives, we were not working in the right direction, but we managed to overcome that. And now we want to protect the health of our citizens. The third question, to me, is extremely important.
ما نطرحه كسؤال بالنسبة للجميع.
And this question is of particular importance to me. We face a lot of difficulties all over the world. Our colleague in Argentina talked about it, our colleagues from Africa as well. There are people who cannot access health services
يعني لقد تم
until now.
الكثير
But I think
فعل الآن النسبة للتغطية الصحية
that remains a small percentage of the population. I think we have reached 80% health coverage. But the fear that we have today is that
المنحنى
the curve might go down. After we reached the top, we reached about 80% health coverage. We have a fear that we will lose this achievement. Why? And this is what we need to pay special attention to, and what we need to pay attention to, especially when we're talking about lifelong learning, and that is our dietary habits. The dietary habits of the population. What do we eat? How do we eat? When do we eat? All of these habits, the food that we eat, that we consume, this is changing. This is changing dramatically. and that might have a negative impact because our diets have changed, when we eat has changed, the mobility of people has changed, dietary patterns are what we need to pay attention to, especially within lifelong learning, because diets and food, if they change, they might have a negative impact on the health of the population.
Thank you. You always give us very practical suggestions and focus on the programs. Thank you again. And Mr. Mario?
Simplemente decir, apoyar a todo lo que está diciendo nuestros colegas, fueron claros, pero veo con mucha esperanza.
I think UNESCO offers a way forward which is very hopeful. People talk about UNESCO throughout the world, and they know that when UNESCO produces a document, and that entails greater budgets for education and healthcare. So when we look at COVID, for example, all eyes were obviously on the pandemic, and we're reviewing circumstances throughout the world and focusing on UNESCO's stance. We can speak and do things, and of course that will help, but things are going to work much better if presidents are fully engaged in committing budgets to our ends, i.e. to education and healthcare. Thank you very much.
Thank you. Because of the time limitations, we have to move to the next stage is open to audience. So, could you please let us know what's your prepared questions? I cannot see very clearly. And I'm so sorry, it's my fault. We have to finish our session and move to the next sessions. Thank you all for for participating in our session. At last, I would like very much to introduce myself. I come from Shanghai. I'm the president of Shanghai Normal University. Shanghai is a beautiful city in China. Hope you invite you visit Shanghai and our university. Thank you again. Thank all of the speakers. Thank you again.
Thank you for your moderating this session and all speakers. لدينا هدية مقدمة من المؤتمر لجميع المتحدثين، هدية تذكارية مستلهمة من حرف الفنون التقليدية بالمملكة العربية السعودية. وهي مزيج فريد يجمع بين الأصالة والحرفية، تروي قصة الإرث السعودي بأسلوب راق وعصري من أعمال المعهد الملكي للفنون التقليدية ورث. انتهت الجلسات العامة ليومنا الثاني من المؤتمر. نلتقي بكم غدا بمشيئة الله تعالى في تمام 9 صباحا، حيث ستكون هناك جلسات أخرى عامة وجلسات موازية بمشيئة الله. الآن سيكون هناك اجتماعات إقليمية، اجتماع إقليمي لإفريقيا، اجتماع إقليمي لآسيا والمحيط الهادي، اجتماع إقليمي للدول العربية، واجتماع إقليمي لأوروبا وأمريكا الشمالية، وأيضا اجتماع إقليمي لأمريكا اللاتينية ومنطقة البحر الكاريبي. You can announce.
Okay, I would just like to announce the next session, which will start immediately. We are going to have our regional forums taking place by world region, and we'll be starting now. So I would invite you to please make your way directly to the regional forum that concerns you. We have the Forum for Africa taking place in room number 3, which is the side auditorium. The regional meeting for the Asia-Pacific region is in room number 4, which is named Ras Al Khair. The regional meeting for the Arab states is in room number 1, named Jubail. And the regional meeting for Europe and North America is in room number 5, named Jazan. And finally, the regional forum for Latin America and the Caribbean is room number 2, Yanbu. So please make your way to the regional forums. They will be starting immediately, and then we will finish for the day with dinner. Thank you.
For your help. I'm so sorry.